This special episode of Health Matters is sponsored by AstraZeneca.
This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're concluding our special cancer series by talking about liver cancer. The liver is the largest internal organ in the human body, and it's the only one with a significant ability to regenerate. But despite this superpower, liver cancer poses a very real risk. So, who is likely to get liver cancer? And how can you reduce your risk? This episode, we're talking with Dr. Susanne Warner. She's a liver and pancreas surgeon at Mayo Clinic in Rochester, Minnesota. Every day, she helps patients with liver disease and liver cancer have healthier livers and healthier lives too. Dr. Susanne Warner, thank you so much for joining us on the show today.
Thank you so much for having me. I'm excited to be here.
Well, we're excited to learn more about something we all have, a liver. For those of us who don't think much about our livers, what does the liver do? What does it look like? What makes it such a special organ?
So the liver is one of the most important organs in the body, and it's about the size of a football or maybe a little bit larger in most patients.
Oh, that's way bigger than I realized. I thought it was the size of a chicken breast. I didn't think it was the size of a football.
Yep. I will say what it does look like is the same as any animal liver you may have seen on a plate, which makes a lot of children go, ugh. It's tucked up under the right-hand side of your rib cage in your upper abdomen.
Wow.
A normal liver should not be palpable very easily, meaning you shouldn't be able to feel it. But if a liver is enlarged or a patient is very slender, you may be able to feel it. So the function of the liver is to act sort of like a fancy filter, but also it's kind of the first line of defense for everything that's gone into your guts. So your guts absorb things and send things into a blood vessel system that is specifically designed to help you process what you eat. It goes into the liver. What the liver likes, it takes out and sends into the rest of your system. Or what it doesn't like, it takes out and helps get out of your body by several different means, whether it's through the blood or into your bile, which is sort of like a waste product, but also something that goes back into our intestines to then help us reabsorb more food.
Okay, let's get into liver cancer. There are a few different types. Can you walk us through those?
When we look at what we call primary cancers that occur in the liver, we're talking about two main types of cancer. One is hepatocellular carcinoma, which is what we call HCC, which is just fancy for cancer that started in the cells of the liver. The other type of primary liver cancer is called cholangiocarcinoma, and that is a cancer that can occur in the bile ducts. And so that is in the little tiny channels and passageways that then deliver bile into a bigger channel that goes into our intestines.
And today we'll be focusing on HCC, or hepatocellular carcinoma. How is this liver cancer similar to and different from other cancers?
So liver cancer is different from cancers in other parts of the body for several different reasons. It's harder to detect because it's in an area where you wouldn't normally feel discomfort. Most of the time, they can grow for a bit without being noticed. Another piece of the puzzle is just how they respond to certain types of treatment. So our traditional chemotherapy treatment does not work very well for liver cancer. So we have to find other weapons against it.
Let's talk about some of the causes or risk factors for cancer. Can we walk through some of the big ones?
It is all of your usual cancer suspects: alcohol, smoking, obesity and then metabolic derangements that come from obesity. Diabetes is one of the biggest risk factors for developing what we used to call fatty liver, which is the way your body metabolizes fats and sugars has affected the way your liver functions. Your metabolism and any diseases you might carry as a result, such as diabetes, high blood pressure, high cholesterol, all of these things can play into risk.
And then there are viral issues that can really affect liver health. I'm thinking of hepatitis, for example.
Absolutely. So hepatitis C and hepatitis B are the number one causes worldwide of liver cancer. Viral illnesses essentially camp out and live in the liver for your entire lifetime. You can be a hepatitis B carrier, or if you have a chronic hepatitis C infection, you can be at risk for developing cancer as well. In the United States, viral causes of liver cancer have now been overtaken by metabolic causes because of curative treatments for viral illnesses for hepatitis C, and then also because of vaccines for hepatitis B.
Now, liver cancer is on the rise. Do we know what's causing that?
We think that it's associated with an increase in obesity-related illnesses, where you also have these other diseases that go alongside obesity. For instance, diabetes, hypertension, and high cholesterol. So because we're seeing people predominantly on Western diets are having a sort of chronically upset liver, it initiates an inflammation and healing process that can make cancer more likely.
So this is the Western diet that is causing such an uptick in cancer?
It's not just the diet, it's a lot of other things going into it. It's also environmental exposure, and it can also be genetic. Sometimes it's not just a direct line from a gas station cheeseburger to a fatty liver, but it can be something that contributes to this. So it's not just diet, but basically a poor diet plus obesity plus diabetes all go hand in hand to place people at increased risk.
Your liver acts as the first line of defense for things that enter your body, whether that's food, germs, or toxins. Risks for liver cancer include drinking alcohol, smoking, being infected with viruses like hepatitis B and C, and metabolic issues associated with obesity like diabetes, high blood pressure, and high cholesterol. While hepatitis is the main cause of liver cancer worldwide, in the U.S., health issues associated with a typical Western diet are a major culprit. While screening is important for any cancer, it's even more critical when that cancer is hard to detect. So let's learn how doctors find and diagnose issues with the liver. You already mentioned liver cancer is really hard to detect because it doesn't usually have obvious symptoms. So how would we even find out if we have it?
It's tricky because first you have to detect liver disease. You don't always get to see that on labs.
What is the difference between liver disease and liver cancer?
So liver disease is a liver that, for whatever reason, is no longer functioning optimally. And that has a spectrum. So we can start with just that fatty liver, for instance, and then we can move into what's called cirrhosis, which is hardening of the liver, and that has several different phases. Liver disease is a risk factor for liver cancer. So you don't always have to have a diseased liver to develop a liver cancer, but you are certainly at significantly higher risk if you start with liver disease.
As you already alluded to, there aren't necessarily things like pain that are telling us that we have liver cancer. Are there any symptoms?
Like I said, it's a very sneaky type of cancer to have. So a lot of people will not have symptoms. Certainly any discomfort that you feel on the right upper side of the abdomen warrants attention. I've had some patients come in and say when they take a deep breath, they have to catch themselves. That generally happens if a tumor is pushing on the lining of the liver or is sitting right under the diaphragm. But I don't want everyone out there who gets a side stitch when they're taking a deep breath to run into the doctor thinking they have liver cancer, because it's a very rare form of presentation. Another way our liver can show us that it's unhappy is it can release what I refer to as liver sweat into the abdomen. So if we have a lot of fluid on our abdomen, that's a sign of pretty advanced liver disease. Also, if you can feel your liver below the right side of the rib cage, that can represent a liver that's bigger than it should be. Sometimes it can also represent just a small patient who has a shallow rib cage, but something to be aware of and know our bodies. Later stages of advanced liver disease or tumors that are blocking off bile ducts can turn people yellow. That's called jaundice. If you have a blocked off bile duct, there's a sequence of events that's pretty standard. So if you see your urine turn a color of iced tea and you are not dehydrated, that is a concerning sign. The next thing that would happen is your stools would turn the color of clay or silvery color. And that's happening because bile is what turns our poop brown. So those two things usually happen before anything else, before the whites of our eyes get yellow or before our skin shows up jaundiced. Now, typically, developing jaundice is not a sign of HCC, but it can be a marker of trouble that needs attention.
So most of us have probably never been screened for liver cancer. It isn't one of those routine things most people do, like a colonoscopy or a mammogram. How do you decide whether to screen someone?
So in order to know who to screen for liver cancer, we can do one of two things. We can take behavioral risk factors. We can take a history of known viral infections, most specifically hepatitis. And we can also take these metabolic risk factors. And taking all of those together, our physicians can know whether or not we should be screened. There are some easy laboratory blood tests that can be put together as a risk calculator. But many patients, unfortunately, because this is a sneaky disease, can have completely normal liver labs and still have liver cancer percolating. So that's where we have to take those higher risk patients and screen them.
So once you determine someone should be screened, what does that screening actually look like?
So once you decide someone needs to be screened, you have to make sure that you have high quality imaging available. So typically it's an alternating ultrasound and or MRI. That's the small donut that makes a lot of noise and people who are claustrophobic just really don't like it. But it's the most perfect way to look at your liver. There are some nuances to that as well, because you can actually have an image that may not even show a cancer if it's not done in the proper way. So what I would advise is if you are in a high risk group and you are engaging in a screening program, it's going to be best for you if that is at a high volume place with a lot of liver expertise.
So we want liver specialists. We want to pay attention to risk factors and so on. What stage is somebody typically at with liver cancer? When you put two and two together, you're like, oh, are people pretty advanced?
Here we walk into another place where liver cancer is a little different from other cancers. So other cancers get number stages, stage 1, 2, 3, and 4. You can still have number stages for HCC, but when we're deciding about treatment, we actually use something called the Barcelona criteria, or BCLC, which takes us stage 0, A, B, and C. So many people will present with stage B or C. C is typically something we can't cure, but we can help the life be a little bit longer or more comfortable. In the earlier stages, we do tend to have a lot of treatment options. Many patients will present with a manageable problem, and because there's so many things on the menu, it's really important to have a multidisciplinary expert team when we're making those decisions.
And what exactly does that team look like?
So, of course, our linchpins of care are our primary care physicians, and they are often the ones to pick up and find the problem with us. Usually when we're then getting into nuanced liver cancer care, they will pass us the ball and we'll run with it for quite some time. The liver cancer multidisciplinary team here includes a hepatologist, which is specifically a liver doctor. We also will engage typically surgeons and sometimes medical oncologists. Those are people who administer a type of medication called immunotherapy or a targeted therapy, which is what can help decrease sizes of liver tumors. But really, what's on the menu for the patient depends on the number of tumors, the size of tumors, and whether or not they're localized to the liver. So that's where we can enter into a little bit more of a complicated discussion of what are some of the things that are on the menu for treatment for liver cancer.
Most people don't show symptoms of liver cancer, so usually risk factors are used to determine who should get screened. Metabolic conditions like diabetes, lifestyle risk factors like high alcohol consumption, a history of hepatitis, and existing liver disease are all reasons someone might need to get screened. Screening typically consists of an alternating ultrasound or an MRI. And it needs to be done correctly to accurately detect liver cancer. So if you are getting screened, it's a good idea to go to a provider who sees lots of liver cancer patients and knows the screening process forwards and backwards. So that's screening and diagnosis. Let's learn what treatment looks like. Let's talk about what kinds of treatments are available. First off, does treatment depend on what stage someone is in, or even the cause of the cancer, or how it presents?
All of the above gets factored in. So health of the liver, reason why the liver got unhealthy in the first place, and then also stage of the cancer does all factor into what's available. When we look at early stage liver cancer patients, what, if any, modifiable liver damage or ongoing liver toxins can be eliminated from the patient's life is extremely important, because a lot of the ways our liver gets hurt can be undone or at least recovered from in some way if we stop, for instance, drinking, or if we change some of our dietary habits.
Wow, that's incredible.
So patients who have a well-functioning liver and maybe one small tumor. Typically, we refer to liver-directed therapies, which means I'm only aiming at the liver. I'm aiming at the one tumor I can see. I've done really nice scans so I can tell that that liver tumor is alone, and then I'm picking the right way to get rid of it. Whether that's surgery, sticking a needle in and burning it, or something else will be determined on the size and the location.
And what if those treatments don't work, or if someone doesn't have a well-functioning liver to begin with?
When we think about what to do next, if we're at the next phase, or if a patient has poor liver function and a tumor that's by itself, the gold standard to cure liver cancer that meets appropriate criteria is a liver transplant.
I'm just curious, though, how do you balance treating the cancer without further damaging the liver, which has already been damaged by the cancer?
When we are making treatment decisions, that's where we really want to try and do the least invasive thing that helps the most. So we have seen, for instance, a shift in tumors that are under 2 centimeters in size. It used to always be recommended that we would go in and do surgery. We now know that if we stick a needle in and burn a tumor that's smaller, that we actually have the same cancer result. So we are evolving as a field to where we try and save as much of the liver as possible. We know that we're not going to be able to cure that patient, but we can lengthen their life. In historical times, we would send that medication to the entire half of the liver, and that would result in liver damage. Now we can do very highly selective treatments where we can send medications or radiation beads up into an artery that blocks off the blood supply to the tumor.
Now, obviously, cutting out less of the liver is a good thing, but isn't it also true that your liver can regenerate?
It's not a regeneration that most people think of. For instance, if I take out the right side of someone's liver, they're never going to get back their right-sided portal vein, bile duct, artery, or hepatic vein that was draining that side. But what's left on the left-hand side will grow big enough to do the job. In most circumstances, you have to have an appropriate proportion of healthy liver tissue left behind. So the standard adage is in a healthy person, 20% of a liver is enough to live on. In a patient who has liver disease or has any other reason that we're worried about liver function, 40% is the minimum.
What a miraculous organ. Do you have any advice for folks out there who are trying to navigate the what ifs and the anxiety dealing with liver health issues?
Liver cancer is one of the only cancers that we can diagnose without taking a biopsy. So I do want people to know that just because there's something on your liver doesn't necessarily mean a needle needs to go into it immediately. The most important thing for patients navigating liver health and or a possible tumor or mass in the liver is to find your way to a place that regularly looks at livers, that has radiologists whose job it is to mostly look in that area, because very often patients will come to us and have their diagnosis changed, upgraded, downgraded, because we know what's normal and what's not.
Now, for people who aren't currently dealing with cancer but need to or want to monitor their liver health, how can those folks know how healthy their liver is? Is there a way the doctor can measure it during their annual health visits?
Unfortunately, some of our annual laboratory tests could be not elevated even when we have a not healthy as it could be liver. So we do want to make sure that our doctor knows, hey, I'm engaged in this habit that may tax my liver, or hey, I have a history of this in my family, to make sure that we're aware of all of our risk factors. That's our first line of defense. But really maintaining a healthy lifestyle, maintaining a healthy weight, and then knowing that if that's not the hand we're dealt and we're dealing with challenges with metabolic syndrome or with the diagnosis of diabetes, plus minus high blood pressure and high cholesterol, that we are at higher risk of developing these things. And so we honestly may even need to make the assumption that our liver is less healthy than it could be and be a little pushy with our care providers if we are worried. And I think that can sometimes help get people's antenna up, but really getting regular physicals and staying healthy is the best thing.
Now, throughout our conversation today, you've mentioned things people can do to reduce their cancer risk. But to wrap things up, can you just give some suggestions of what we can do so that we can take better care of our livers? We can treat our livers like the heroes they are.
Absolutely. It was funny. I saw a meme one time that said, here's the best detox diet you can do. Sit on your couch and let your liver do its job. So the liver is kind of the hero.
Hold on. Don't do that thing in the TikTok video where I starve myself for 4 days and then do the lemon juice?
No, I don't think there's a lot of good evidence for that. What I will say is all things in moderation. So I tend to encourage my patients to lean away from high dose, unregulated things being put in their body and favor more moderation. What's healthy for you is healthy for your liver. Diet, exercise, making sure you have a diverse microbiome by eating pickled vegetables and mushrooms and raw fruits and vegetables and lean meats and long grains, minimizing alcohol, minimizing Tylenol as well. That's actually one of the number one liver damaging agents for young people.
These are all such great tips. And just to give us some hope to end on, do you have some stories of folks who successfully recovered from liver disease or from liver cancer?
So I can think of one patient, relatively young parent, who had been told multiple different things, all the way from you need to call the preacher because this is a horrible problem to, well, I'm not really sure if this is benign or malignant. Could be this, could be that. and came to us needing answers. We were able to establish that what this patient had was a precancerous lesion called a hepatic adenoma that can turn into liver cancer. We were able to do a minimally invasive surgery to remove a small portion of their liver along with the tumor. We were able to help the patient find a healthy liver lifestyle moving forward. And that patient is several years from treatment now with no evidence of any additional problems.
The frustration where that one doctor saying one thing, another doctor saying another.
And the fear during that diagnostic journey and the roller coaster, it's a huge privilege that I can sit in front of a patient and deliver definitive answers. And it's one of the biggest reasons why I love working here. I can think of several other patients who were our usual suspects who came in, had a history of 3 martini lunches, had one small liver tumor, had that removed. And I still get text messages with, "Thanks, doc, for giving me these extra years."
Oh, that's great. Dr. Susanne Warner, thank you so much for the work you do. And thank you so much for talking with us today. This has been great.
Thank you for your time. And thank you for promoting liver health. I love this podcast. I'm a fan. So it's fun to be sitting with you.
Thank you. I'm a huge fan of all of you. Every Mayo doctor I talk with, I'm like, oh my God, I'm talking with a superhero. Treatment for liver cancer will depend on the stage and cause, as well as how healthy the liver is to begin with. But one thing's for certain, doctors try to preserve as much of the liver as possible, and as the science progresses, they're getting better at it. Since liver cancer is hard to catch, part of prevention is understanding your own personal risk. So if you have any known risk factors, it's important to share that information with your primary care provider so they can help you keep an eye on things. And there are some things we can all do to keep our livers healthy. We can consume alcohol and other substances in moderation, and be careful with medications like acetaminophen or Tylenol. And then, of course, there's good old diet and exercise. Because at the end of the day, a healthy liver and a healthy life go hand in hand. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy. This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.